Well, good evening, ladies and gentlemen, and welcome to COVID Conversations. My name is Steve Watt. I'm so glad you could join us tonight. This is a show about the lives of ordinary people on the Mid-North Coast of New South Wales during the pandemic of 2020. In each episode, we're going to discuss what life has been like these past few months. And we're also going to consider the difference that faith in Jesus has made. COVID Conversations is brought to you by ReDiscover Jesus, a partnership of local churches on the Mid-North Coast of New South Wales. And our aim is to promote conversation about the things that really matter in life and the difference that Jesus makes. As we broadcast our conversations over the next few fortnights, our hope is that you are going to get into some conversations with people you know too. Perhaps there's someone you'd like to invite to watch the show tonight. At any point, you can click on the share button and invite them to watch with you. Now, look, let me introduce you to my co-host. She's lived on the Mid-North Coast for more than 20 years. She's a proud mother and grandmother, a committed member of Camden Haven Anglican Church, and she loves gardening. Would you please use an appropriate reaction icon to welcome Kirsti Purss. Hello, Kirsti. How are you?
Hi, Steve. I'm very well, thank you. Hi, everyone. It's lovely to be here. It's a very new experience for me. I find this technology quite extraordinary, having grown up in Papua New Guinea, and then going to boarding school, where I had about a 4 to 6 week turnaround time to get a response in a conversation to my parents. This is amazing. When I had my first child, they were living in Nepal, and I could send them a fax and had a 1 day turnaround time. And here we are talking to the public on a one-to-one basis. It's fantastic.
And we don't even have to leave the comfort of our own homes to do it. Yeah, I agree. It really is amazing. From 6 weeks to instantly, just in your lifetime, that's amazing. Well, it's time to begin the conversation. Tonight, we're talking to a frontline medical worker about the stress and uncertainty of the past few months. What changes has COVID-19 meant for his work? And how has it impacted his home life? Joining us tonight is an old friend of mine from my undergrad days at Newcastle University. I studied music, he studied medicine, and now he's moved to the Mid-North Coast just over 3 years ago and is a doctor in the emergency department of the Port Macquarie-based hospital. He's also a mad Collingwood fan, and I imagine he's quite excited about the league restarting in just over 2 weeks, and that his team is going to be playing the first game, which is good. He's married to Alison and has 2 wonderful kids. Would you please again use an appropriate reaction icon to welcome Dr. David Thomson? How are you, Dave?
Good to be here.
Look, I'm really excited to have you on the show. I'm really, really excited to have an old friend to be our first first guest. Thanks for being here. Now, at the end of the show, if there's time, there should be time, Dave's going to take questions. So if you'd like to ask Dave something, you can type a question into your comment feed of the live stream, either on YouTube or on Facebook, whichever one you're watching on. And I think it's over to you, Kirsti.
Okay, thanks, Steve. Hi, Dave. And nice to see you. And thanks very much for being willing. Dave, when COVID-19 first started to become a reality in Australia, what were you expecting that it could be like for you?
Yeah, no, thanks, Kirsti. So I guess I was expecting it was going to be a really, really difficult year. So when things first started kicking off overseas, I listened to a lot of podcasts from people in Italy and then New York and the UK. And it seemed like things were just incredibly tough over there. Like, they gave stories of just huge volumes of patients coming in requiring very intensive levels of support. And it seemed like there were a number of places that were kind of overrun with cases. And I was expecting that we were going to kind of follow a similar path and have something like that happening here. So that was my thoughts going into it.
And that hasn't actually been the case for us. We've been very privileged. And so how do you feel about the way that our government, our country has managed the situation?
Yeah, mate, I've been pretty stoked with the way things have gone. I think we had a few things in our advantage. One being an island nation, it was a lot easier to kind of close the borders and lock down. But I feel like the government's managed it very well. The health advice has always been very clear. And I think we locked down hard enough, early enough to stop it before we had widespread community transmission. And at least my personal analysis of it is, you look at a lot of the places overseas, if they pull the trigger after you had that widespread community transmission of the virus, they just couldn't rein things back. So I think we were very fortunate that we did it when we did.
So David, sounds like you think lockdown has been worth the effort?
Yeah, mate, definitely. I think the main reason for that is that it's really the only weapon we have against this virus. This is a new virus. No one has immunity to anything like this. And we have no treatments for it. And the patients who get really sick, even the most invasive things that we can do, the majority of people will still die with this. So there's really, all we can do is kind of limit the spread and try and stop other people getting it. And I think it has been really effective. If you look at, say, countries overseas like Sweden, who've still encouraged kind of physical distancing and maintaining the distance from people, but haven't locked down like we did, their death rate relative to the number of people in their country is about 200 times what it is here. So I think as much as it's been a really difficult kind of 6 to 8 weeks to everybody, I think we will look back on this down the track and go and just be very grateful for the fact that the government made the moves that it did.
Yeah, okay. Because I've heard a lot of people kind of complaining, feeling like this whole thing's been a bit of a flash in the pan and maybe we kind of overreacted. But it sounds like you don't agree with that at all.
No, look, I would disagree, Steve. I think it is one of the hard things about good public health policy is if you make all these changes and interventions to prevent a disaster and then the disaster doesn't happen, people say, well, that was a bit of a waste of time. But I think with this one, you only have to look at what's happening overseas. Like the US just passed 100,000 deaths. Like looking at UK, Europe, it very easily could have been like that here as well. So,
and what's the percentage? Also, what's the number of deaths in Australia?
Last time I looked, it was 100 and maybe 101 now. So, yeah.
That's pretty big difference, isn't it? 101 versus 100,000.
Yeah, and obviously they have a lot more people than we do over there, but they still have, again, relative to the population, 60 times the death rate that we have here. So it's a huge difference.
Yeah, wow. Dave, given that your job is on the front line of medicine and your risk of coming into contact with the virus is very real, how has that affected you and your family in your family life?
Yeah, so I guess it did make us think through kind of how we approached work a bit. So even in working in emergency, like you're exposed to a lot of viruses and other things like that, but you don't often go to work concerned about the fact that you may bring something home that could impact on your family. And so at our house, my wife's pregnant. My youngest daughter had a lung condition when she was born that's meant kind of half of her right lung got removed at 11 months. And so even though like a lot of the data would suggest that those groups aren't overly impacted by COVID-19, there was still, I wanted to try to make every step I could to make sure I wasn't bringing that home. And so we did a lot of thinking about how we'd approach things if I was to become unwell, how I was going to isolate from the family, and some contingency plans on what to do with that. And I guess the only other thing that would be maybe different from other people is we made the decision to isolate a bit earlier than the government. Partly because I didn't want to be giving it to other people, but also because if I was to become sick, that's at least 2 weeks off work, probably, if you get quite unwell. And when we thought this was going to be quite bad, and we were expecting there'll be lots of staff members off over the course. And so I just wanted to make sure I wasn't picking anything up that would impact there as well.
Yeah. So at the end of the day, did you have to put some physical things in place when you got home that was different to what you normally do?
Yeah, so I just had a disinfection regime, basically. So I was always being fairly blasé about all that, but basically everything that I took to work kind of came off, and we got that like kind of antibacterial wipes, and I'd wash all my clothes in kind of hot temperature and have a shower kind of before I came and saw anyone at home. Everything that came from work stayed in a box in the garage and wouldn't come into the house.
Right.
And it was just a few changes like that. And that wasn't just me. That was something like healthcare workers all over the world have been doing. But yeah, the routine definitely changed quite a bit.
Right.
Is that something you think we should all be doing, Dave?
No, I don't think unless you're exposed to it. So I'm not doing that so much now. I mean, here in Port Macquarie, we haven't had a case for about a month. And so I've kind of stepped back at that. But if you are a healthcare worker and say there was a lot of this around, you are exposed to more likely to be exposed, but also it's a higher viral load like that you'd be exposed to. And so I think with that level of exposure that you just need to take some more precautions. Yeah.
I've heard that from a few people actually, that it's the viral load that's really the thing that makes a difference. It's the amount of virus you're exposed to. Is that, am I understanding that term correctly?
That's one of the factors in play. There's also how people's underlying health issues. So if you have heart or lung issues at a baseline, you're more likely to get more unwell, and a number of other things in play with that. There's still a lot about this virus that we don't fully understand as much as we would, but definitely if you're exposed to a high viral load, the likelihood is you will probably get sicker.
Thanks for sharing that. Look, if you've only just joined us, you're watching COVID Conversations. Steve Watt is my name. My co-host is Kirsti Purss, and our guest tonight is Dr. David Thomson. And if you've got a question for Dave, you can do that by typing it into the comments on the live stream, either on Facebook or on YouTube. And if someone's already asked the question that's there and you really want to hear the answer to that, why don't you give their question a thumbs up? That'll help us pick which questions we're going to answer. Now, Dave, as we begin to follow our Prime Minister's plan to get Australia out from under the doona, have you got any pro tips about how we can go about doing that safely?
Yeah, look, I do. I listened to a media conference by the New South Wales Health Minister recently who gave some very good advice. And his advice was to assume that you're infected. And I guess what he meant by that is, I think it's very important as we come out of this, that if people are sick at all, that they do isolate, stay away from other people, kind of get tested and not then go out and see people and do normal things until they are kind of well again. And the other thing I think is you also want to maintain the physical distancing there, because the tricky thing about something like COVID-19 is people can be infectious up to a few days before they develop symptoms at all. So I could be speaking to you outside, Steve, and you could have the illness and you wouldn't even know it. And so that's where it's helpful to maintain that 1.5 meter gap, so that any kind of respiratory droplets that may come out when you're even just talking are less likely to less likely to kind of infect me. And I think it's just simple things like that, and people maintaining hand hygiene and just kind of following the government kind of directives will all go a long way to making sure that we don't get a secondary spike in cases like some other countries have as they've come out of lockdown.
As you said, it's kind of the only tool we've got, isn't it? That we just try and control infection.
Yep. Yeah, that's it. So yeah, unless you believe Donald Trump and
and injecting bleach. Yeah. Yeah, let's not go there. Let's not go there.
Dave, with COVID-19 statistics all around us and seeing the spotlight on the number of deaths, do you think that this has changed the conversation about death amongst your friends or your family or your colleagues at all?
Oh, look, it's hard to say, Kirsti, because I've hardly seen any of them. Look, not so much at work. I say it's like death's kind of part of what you deal with at work. I haven't really had any conversations there. But I guess I would have thought for a lot of people that, especially when we weren't sure we were going to do as well as we have, that it may have brought up some questions about that. Because especially, say, if you look at places like the United States and how many people are dying there is a real risk that either people or someone they love or someone they know will be impacted and potentially die by this. So I guess it brings that a bit closer than that concept of death comes a bit closer than what it would have been normal day-to-day life, probably. Yeah.
Yeah. Mm-hmm. Yeah.
Dave, how has your faith helped you during this time as you've kind of thinking about this reality of death? You're a believer in Jesus. How has your faith impacted the way you think about this whole situation?
So I guess for me, so like you say, I'm a Christian, so I believe there is a God. I believe that he created the universe and that he is still in control of the universe, even when things like this are going on. So the way that's helpful for me is that I know that God's in control. And I guess what the Bible teaches us and Christian faith teaches us is that God is a personal God as well. And so I can take any concerns and any fears I have with this and just kind of speak to God about them, and then just kind of leave them with him, knowing that he's in control, and then just kind of go and do the next thing. So for me, that's been quite helpful. And I can definitely think of times when I probably would have struggled with stuff if I didn't have that certainty that someone much bigger and wiser and stronger than me has control over what's happening.
Mm-hmm. Yeah.
And a couple of days ago, you shared with me a Bible verse that kind of summarizes that. Let me just see if I can get it on screen. Hopefully, that's appearing on screen for our viewers now. So this comes from one of the New Testament letters. It says, "Do not be anxious about anything, but in every situation, by prayer and petition, with thanksgiving, present your requests to God." Do you want to just take us through that, Dave? What is it about that verse that really comforts you at the moment?
Well, I guess the fantastic thing about that verse, Steve, is just the whole idea that if there is a God that created the universe, the fact that he cares at all about what's going on with me and our cares and concerns is phenomenal. And so I guess the thing that's helpful for me in that is that I can talk to God in prayer, because that's all prayer really is, and ask him for just to help with situations, or ask him to intervene with things like coronavirus, and know that he will do the right thing with that. And that just enables me to trust him. And then, I can leave my concerns and my fears at his table. Yeah.
It is a big comfort, isn't it? Knowing that you have a hotline to the creator of the universe, the one who's in control, and that he cares.
Yep.
Dave, in speaking about this in your faith, this virus has affected almost every single man, woman, and child on the planet in some way or another. It's in every single community. Doesn't matter who you are. Doesn't matter whether you're the Prime Minister of the of the UK, or whether you are, or the Prime Minister of England, or whether you are, a man in the street, the man next door. So with this in mind, how do you see God in this situation? Do you see, in your understanding, is this something that God has inflicted on us, or do you have another perspective?
Yeah, and Kirsti, I was very glad you gave me this question a couple of days out, because it was nice to have a think about it before answering. Look, I guess my honest answer would be, I don't know where God is in this, or how this has happened. And I guess to some extent that's fairly understandable. I mean, there are days where I can barely get my kids out to school in time, let alone have any idea how this universe kind of continues to exist and be sustained. So it's hard to answer that question, but I guess the question I can answer is, I guess, as a Christian, how is it that I can still maintain faith in a loving and a good God in the midst of things like COVID-19 or other stuff in the world, like kind of cancer and child poverty and a lot of the other issues we see around us. And I guess as a young person, this was a concept that I really kind of wrestled with and grappled with, because I could never really understand how, if there was a good God, how he could allow all these things to happen. And for me, at least, I took a lot of comfort from the book of Job. So if you give me 20 seconds, I guess very quickly, for people who haven't read this book before, the story of Job is about a guy who loved God and was blessed by God, and he was healthy, he was successful, he had this large family. And then one day, kind of, God took it all away, and Job never knew why. So he lost all of his children, he lost his wealth, he was afflicted by kind of painful boils all over his body. And over the course of the book, he tries to kind of work out why this happened. He gets some bad advice from some friends, and eventually he kind of cracks and accuses God of injustice. And And what happens then is that kind of God then comes down and speaks to him and reveals to Job his glory and his majesty and his character. And the interesting thing is that wasn't enough for Job, and he could get off the mat and rise up and go on with his life. And when I was a young person, I didn't quite understand how that worked. But I guess now looking back, I guess the way I see that is that once Job understood who God was and how good God is and how loving he is and how powerful he is, that even though he didn't understand why this had happened and God never told him why this had happened, he could then trust God in this and have faith in God despite his suffering. Mm-hmm. And so I guess for me as a Christian, thousands of years later, especially after the cross, I can also look at God's character, and I kind of mainly see that through the cross. So the Christian teaching, I guess, is that there is a God of the universe and that we all have sinned against him and deserve to be punished for that. And what Jesus has done is kind of taken the form of man in the historic figure of Jesus Christ and paid the price for my sins, which is something that I don't deserve. And so I guess at the cross, I see a God who entered into my suffering, who's not remote and aloof and removed from it, but he entered into it. And I can see his love and his mercy and his justice. And so that's helpful for me because I can look at that and know that he is good, and then have faith that whatever is going on here, which are things that I can't understand, that there is a reason behind it all, and I can trust him in that.
Mm. And
sorry, go on, Kirsti. I jumped into
I was just going to say that is such an incredible comfort, knowing that no matter what, you can trust God with your best interests. And that may not be exactly what you expect to happen, but at the end of the day, you know that you can learn from the situation, and you can gain from the situation, and that God is God, and we can trust him.
Yeah. We've actually got a couple of questions have come in on the live stream that actually follow on from this, Dave. So Graham has asked, do you ever feel like God is distant because you see so much suffering? And it sounds like, based on what you've already said, that no, you don't feel like God is distant because he actually entered into our suffering.
Yeah, like I think I'd say I have in the past, but not anymore. No, I can look at that and know that God is God and he is good, and I am not. And so while I can't understand how things work, I can trust him in that. But it was a rather long process to get there, I think. Yeah.
Do you want to just very briefly, what were some of the things that were helpful in that process for you? Yeah,
so I think one of the things that was really helpful for me is I think I grew up with the assumption that, like, I grew up in a Christian family, so I always, I thought there was God growing up, and even though I questioned it a bit along the way, that was my assumption growing up. But I always felt like God owed me something, like Jesus came to save me, and he owed me kind of life and wealth and happiness. And I think the main thing that changed was realizing that actually what he owes me is his judgment for the things that I've done. And he doesn't owe me any of those good things. And everything that he gives me is a grace, and he is kind of mercy towards me. And I think I had it flipped in my head the wrong way. So I think that was helpful for me. And then I read a few books, and just a lot of time in the Bible, and all those things together made a big difference. Yeah.
Sure. Look, thanks for sharing. I think your answer there would go some way to answering a similar question from Michael. We've got another question that's come in from Camden Haven Anglican Church. Bit of a ease back. We'll go a slightly lighter question. Do you know just roughly how many local people have been infected with coronavirus?
Yeah, so we had a few cases that we were all pretty sure were what we call false positives. But I think I really should know the stats. It's about probably in the Port Macquarie area, 35 to 40. So not a huge amount. And we haven't had a case for a month, like I said. But it's around that number, maybe as much as 50. So I should know those stats. Sorry, Steve.
Well, that's all right. Well done, Port Macquarie, and in fact, the entire Mid-North Coast. That's some pretty low numbers. As a kind of, again, a follow-on question from that, is it likely that it's going to return again next flu season?
Yeah, so what they think is that this is a virus that's just going to stick around. And that's why there's such a push on like getting a vaccine or some treatments that are helpful, because it is likely that this virus won't die out. So in the last kind of 20 years or so, we've had a few other pandemics. We had kind of MERS and SARS and other things like that. And we don't see a huge amount of that anymore. But this virus is, I guess, it's very infectious, but it also doesn't kill quite as high proportion of people as some of the other ones, which means that it can then infect lots of other people, whereas the other ones are much more severe, so tend to get a big cluster of cases and then it doesn't travel as far. I should stress though that I'm just an emergency doctor, so I'm not a public health expert or infectious diseases expert, but that's my understanding of it. I think it's gonna stick around. Yeah.
Sure, okay.
So Dave, there's another question from Dave out there who's asking, is this actually worse than what the government is saying?
I guess I'm not sure when they say what this refers to. Sorry, Kirsti. But I guess if they're saying is the virus worse than the government's saying, say we assume that. Look, I think the government's been very upfront about what's going on, and people have been very open with the level of risk here. So no, look, I don't think it is.
Yeah.
Well, this has been fascinating. I think we could keep talking about this all night, but sadly we're out of time. Look, thank you so much for joining us tonight. Dave, like always, it's been a real pleasure chatting with you.
Thanks, Steve. You too. Thanks, Kirsti.
Thank you, Dave.
Kirsti, who have we got next time on COVID Conversations?
Okay, so next time we're going to have a young woman called Brianna Daniels, who's a local Mid-North Coast lady. She is a young mother with 2 little boys and is married to Elijah. She comes from a Christian family, but took her own road for a while and then arrived at a point where she realized that she had to really consider Jesus for herself. And so she's going to tell us about that next time.
That sounds fascinating. I'm looking forward to that. Well, thanks for joining us tonight, everyone. COVID Convos will be back on June the 11th at 7:30 p.m. Good night.
Good night, everyone.